Is everyone ready? Great. Well, first of all, thank you and good morning, everyone. Thank you for being here. Every day across San Diego County, we see the impact of what happens when mental health and addiction needs are not met on time. We see the crisis in our streets, in our emergency rooms, in our jails, and in our parks. And no one is immune from it. The sad reality is that nobody should have to face their darkest moments alone. So that is why our county has been taking action to build care before crisis. So today, we're here to discuss our newest endeavor, our launch of our Behavioral Health Wellness Center. Because right here on the site of the old County Health Services Complex, next to our psychiatric hospital, we're proposing this Behavioral Health Wellness Campus, which will be a place where people can find care, stability, and dignity under one roof. For far too long, families have had to navigate a maze of disconnected programs in their worst moments. And the result has been overcrowded ERs, rising homelessness, and people falling through the cracks. This campus changes that. As you can see on the renderings to my left, what this campus will include. It includes a place for crisis stabilization, a place for long-term mental health treatment, a place for peer support and recovery, and all will be connected in one location, so nobody has to start over or through a different door. Last week, our board voted to apply for $100 million in Proposition 1 funding. $100 million in Prop 1 state funding that voters approved last year to make this project a reality. The county would contribute the remaining costs. So the first step, the first part of this fight, is securing the funding. And then we will work together with our community partners to make this happen in a way that works for all of our neighbors. This project builds on the progress we've made expanding crisis stabilization units, launching mobile crisis response teams, and doubling residential treatment capacity throughout the region. This is part of our large comprehensive effort to fix a system that for too long asked people to fend for themselves and instead build up a local system in San Diego County rooted in care, connection, and accountability. And as an economist, I know that investing in care before crisis saves lives and taxpayer dollars. As a San Diegan, I know this is simply the right and the moral thing to do. So I'm joined here today by people who know this work inside and out. Their voices and experiences are what guide us. So thank you all for being here, for your leadership, and for believing that recovery should be possible for everyone, not just the lucky few. So first, I'd like to introduce Nadia Privera-Brahms, our acting director for San Diego County Behavioral Health Services, the agency that has proposed the vision of this campus. Nadia.
Thank you. Thank you, Chair Lawson-Remer, and good morning, everybody. I'm honored to be here today to share the county's vision for the Behavioral Health Wellness Campus, a project that represents an important step forward in expanding access to specialty behavioral health care within San Diego County. The vision for the campus, which we hope to see developed through Proposition 1 bond grant funds, will offer a full continuum of care for our Medi-Cal members with serious behavioral health needs. Located here on this county-owned property, the Behavioral Health Wellness Campus will bring together a comprehensive array of treatment and support services within 5 new state-of-the-art facilities co-located together. These new services will also get us one step closer toward the goals we outlined in our substance use and mental health optimal care pathways models. The integrated campus will feature 5 distinct services, including first, a crisis stabilization unit that will provide immediate short-term care for people experiencing a behavioral health crisis. Second, a mental health rehabilitation center, which is a secured facility that will support our members with complex needs and allow them to step down from hospital settings, including the San Diego County Psychiatric Hospital. Third, a social rehabilitation facility that will provide intensive short-term and peer-based support in a recovery-oriented setting. This service supports diversion from hospitalization and non-medical transitional placement for members ready to be discharged from a hospital. The fourth facility is an adult residential substance use treatment center that includes withdrawal management. It will provide a safe, supportive environment for adults to live while receiving care for substance use. And last, the outpatient community health clinic will provide treatment and support to members with mental health and co-occurring conditions. Members receiving care within the campus will also be linked to other community-based services, including housing, vocational support, and long-term treatment services to promote sustained wellness and stability. Overall, the campus will add approximately 125 new treatment beds and 51 crisis care and outpatient slots that will provide care for more than 8,700 individuals annually. It will also strengthen our county's ability to support people with complex needs, including people referred to care under Senate Bill 43, Proposition 36, and the CARE Act. Collectively, we will strive to provide a seamless continuum of care that supports people experiencing a crisis through their journey to recovery and long-term stability. The Behavioral Health Wellness Campus reflects that what we can achieve when we all work together, county leadership, community partners, and dedicated providers, to build a stronger, more compassionate system of care. Thank you again to our partners and stakeholders and the community for your ongoing support and collaboration as we bring this vision to life. Together, we are united in our mission to build a system where all San Diegans have access to the behavioral health care they need.
Thank you, Nadia, and thank you for all of your leadership in bringing this forward. Our next speaker is Dr. Steve Coe, a psychiatrist in chief and associate chief medical officer for behavioral health at UC San Diego.
Thank you very much. UC San Diego Health and County BHS and County Board of Supervisors have been partners for a very, very long time. Our Hillcrest campus is a sister hospital just up the hill, and we see patients together in partnership for decades now. And interestingly enough, personally, one of my first jobs was actually here, seeing patients at the emergency psych unit. So as I look back on my career and think about our partnerships as we lead together the new vision of how behavioral health could be delivered to our fellow San Diegans, I'm proud to say how much of an evolutionary process this wellness center represents. And the word I'd like to focus on is the word home. As you know, behavioral health patients, including substance use patients, and housing has been discussed for quite some time. But we need to think about this from a perspective of how do we make people better? And is the home just simply four walls and a roof? I would argue as a psychiatrist that it's actually more than that. When we see patients in our emergency rooms and we quote unquote stabilize them, where do they go? We tell them, go to this address. We will put you on a ride share, or you need to find your own way. They might get there, they may not get there. And then after that, they're asked to go somewhere else. That's not a care home, if you think about it. You're just simply punting the problem and telling that patient who's under distress that they need to find their own way. This type of integrated model located here in Rosecrans campus is going to try to fix that. Where a patient will get their acute needs met, then depending on where they are, you could simply say, we have one of my colleagues literally across the hallway, across the street here, who will take you in right now. You don't have to wait. You don't have to go through a new intake process, having to tell your story over and over again. Right? Imagine what that could be. It could become a wellness home for these patients for the first time. So it's very exciting for me to see where this campus is going to go under county's leadership. And from UC San Diego Health, we're partnering with them through and throughout. And we're happy to work with them not only from our Hillcrest campus, but also our East Campus to ensure that we're creating these integrated models that could become a really an example for the rest of the state and the country. So thank you very much.
Thank you. So our next speaker is Anita Fisher, a mom who knows the mental health system very well after supporting her son. She's also a retired member of NAMI San Diego who still facilitates family-to-family classes and support groups as a volunteer. Anita?
Thank you and good afternoon. So yes, I'm the mother of an adult son who has lived with serious mental illness and substance use disorder, also known as co-occurring disorder, for the last 25 years right here in San Diego County. And I also speak on behalf of the many families like ours whose loved ones fall in between the cracks that I have met through the NAMI Family to Family and NAMI Family Support Groups. This is often happens because they have to transition in between different and multiple locations, especially after coming out of crisis care. And that may seem simple for anyone else, but someone with a serious mental illness failing this seemingly simple challenge can result in homelessness, substance misuse, incarceration, instead of receiving the help that they need. So individuals with serious mental illness and substance use disorder who are experiencing acute symptoms, they often require immediate care. So I'm very excited about this campus. My son has been on this location before on many occasions. But now if he has to return, to see that he won't have to get a piece of paper with an address to go here or go there, and oftentimes that's too overwhelming for him. So he may go right back to where he came from, which could be the streets, which could be using, illegal substances. So I am hopeful that this will come to fruition and help not just my son, but the many other families throughout San Diego County. So thank you.
Thank you, Anita, and thank you to all of today's speakers for sharing your expertise and your experiences. So now we can take any questions from the press.